Good evening, everyone. So when we talk about the tongue diagnosis is the part of Ayurveda as well as the TCM. So we are studying the tongue diagnosis in both. They're little bit different, but basics are the same. So first, we have to see these 5 things, right? So we are telling the patient, okay, show me your tongue. The person is showing the tongue. So first we are looking the vitality and the spirit. What is the meaning of vitality and the spirit? Like suppose someone is very enthusiastic, someone is very energetic, like having good virility, eager to do anything, like ready to do anything, no dullness. So we are telling, oh, this person is very having good vitality. So even we can see the tongue is having very good vitality. We can see good sign in the tongue, good vitality in the tongue. If we start the treatment, this person will get very fast results. Why? Because body is supporting, because this person is having very good spirit. Then the second thing we are looking about the color of the tongue. So whether the red tongue or the pale tongue or the white tongue or some other color also representing many things. Third, we are looking the shape of the tongue. Many persons are having straight tongue, some person are having a deviated tongue. So it is also telling a lot about the person. The fourth thing and the very important thing about the coating. So we always see coating on the tongue, and by seeing the coating, color of coating, the thickness of the coating, also we can declare the person is having some problem or not. And the final moisture, tongue is having enough water, enough moisture or not. So whenever we are doing tongue diagnosis, we are telling the person, can you show me your tongue? Yes. Then after the person showing the tongue, always remember these 5 things. Just don't do the tongue diagnosis just by the coating, just by the color and all. Kindly go through with all the 5 things. These are the 5 basic things about the tongue. Now look at here. We can divide the tongue in 3 parts. So if we divide the whole tongue in 3 parts, look at in this image. So this is the upper part. It is doing the representation of the upper body. Or we are telling this is doing the representation of upper barmer. The meaning of upper barmer, if you look at the human body. So the meaning of upper barmer is this whole part, which include your brain, which includes lungs as well as the heart. So when we are looking this part of the tongue, this part is doing the representation of the upper body, and by looking this, we can find out the health of brain, we can find out the health of lung as well as the heart. Okay, so we will see various changes if the person suffering with the problem of these. Now coming to the middle part. If we see the middle part of the tongue, the middle part is doing the representation of the middle body. So whether the person having any problem in the stomach or the spleen, or suffering with the diabetes, having some problem in the pancreas. So if the person having any problem in the middle part of the body, we are looking this part. Now going to the lower part, what we have in the lower part. So the same thing are represented by the lower 1/3 of the tongue. So those lower part is doing the representation of the lower body. Like in the lower body, we have intestine. In the lower body, we have uterus, prostate. Okay, so all the lower part of the body, like the kidney, like the urinary bladder, represented by this part of the tongue. So the tongue is doing the representation of the whole body. And the beautiful thing is this, just you can do the diagnosis in 30 seconds. Why? Because you will tell the person, show me tongue out, you're looking this part, this part, this part, diagnosis completed instantly. So when we talk about the pulse, it might take little more time, because you should learn all the theory of the pulse. Then you should develop lots of like subtle vibration, so that you can feel the subtle vibration. Then you will able to check the pulse. Even pulse diagnosis is very good. But the tongue diagnosis is also very good for the layman who is not much aware with the very deeper and subtle things. So let's go ahead. Now look at here. When we talk about the Ayurveda, in the Ayurveda, this is the tongue diagnosis image as per the Ayurveda. And kindly remember, this is the mirror image. The meaning of mirror image, suppose you are taking your tongue out and looking your tongue in the mirror, right? So again, we have divided the tongue in three parts, right? So this is the upper part, this is the middle part, and this is the lower part of the tongue. Upper part is doing the representation of upper body or the upper barmer. So we can see the location of right and left lung. Okay, so the right lung will be on the right side, the left lung will be on the left side. Now, if we go in the middle part, which is doing the representation of the middle body, so we are having liver and spleen. So liver will be on the right side and spleen will be on the left side, same like we have in the body. And the lower part doing the representation of the lower body. So we can see the right kidney in the right side and the left kidney will be in the left side. So in this way, we are having the location of all body part same like what we have in our body. Now something happened wrong here, 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 or here. We can diagnose and we can declare the person is suffering with certain problem, and now we have to work on these organs. Suppose someone is having some discoloration, some changes in the tongue here on the liver part, then we can declare easily the person is suffering with the liver disorder. So this is the Ayurveda concept. As per the Ayurveda concept, whatever organ we are having in the right side, they will be represented on the tongue on the right side, and even same for the left side. So look at here once again. So if you see your body, so this is the human body. And we are having a spine just in the center. So we are looking the body from the back side, and this is the spine, right? So the center part of the tongue is doing the representation of the spine. So many persons are having central crack. If you see your tongue, or if you see the tongue of someone else, the many persons are developing the central crack, right? So this central part or the central crack also representing many things. So the central part is doing the correspondence with spinal cord. So this is the spinal column, same like the body. So after searching the spinal column in the central part, now we will divide the tongue in three parts: right lung on the right side, left lung on the left side, liver on the right side, spleen on the left side, kidney on the right side, and other kidney on the left side. So if you see this image, now divide this image in three parts. So we are dividing from here. This is the upper part. In the upper part, we have lungs. On the right side, we have right lung. On the left side, we have left lung. And in the center, we also have heart in the upper part. Now going to the middle part. In the middle part, we have liver on the right side. Spleen will be on the left side. And center will be having stomach. Now we are going in the lower part. In the lower part, we are having right kidney. On the left side, we have left kidney. And in between, we have intestine. So we have all the structure in the body in the same way we are having the structure on the tongue. So now again, do the imagination. This is the right kidney. We are looking the mirror image. This is the left kidney. In between, we have intestine. So when you are looking the tongue and you are asking the person, okay, show me the tongue. Now you are looking the root of the tongue, and root of the tongue doing the representation of the kidney as well as the intestine. So if some person is constipated, if some person is having constipation problem, you will see the changes here. What type of changes we will see, we are going to discuss in the upcoming classes. So this is the doing the representation of the kidney and the intestine. Now let's come to the middle part. This is the middle part. So in the right side, we can see liver. So if something wrong here, we can declare, oh, this person is suffering with the fatty liver or the cirrhosis of liver or the liver heat. If this part is red, we can tell liver heat. So in the body, we have liver on the right side. So in the tongue also, we will be having liver on the right side. In the body, we have spleen on the left side. So in the tongue also, we will be having spleen on the left side, right? In this way. Now, stomach is in between and the pancreas in between. So this part playing a very important role when we're talking about the diabetes and when we're talking about the stomach condition, right? So stomach located in the center as per this Ayurveda tongue diagnosis. Now, we will go in the upper part. We can see the right lung here on the right side. We can see the left lung on the left side. Again, I'm telling this is the mirror image, and we can see the heart in the center. So this is a very beautiful imagination, and the complete spine is located in the center. Now, if we know little more, then even we can declare what is the exactly problem in the left kidney, whether the left kidney is having this problem, that problem, whether the kidney is having a stone, whether the kidney is suffering with this problem. Just by looking the tongue diagnosis, we can declare anything. So tongue exactly like the body. So I will tell you, I will give you the example of one of my patient. One patient came to me and I told the patient, okay, can you show me a tongue? Then the patient showed me, I have seen the tongue of the patient, and this part having black spots here. This part is having black spots, this part. So now tell me what you can tell if this part is having black spot, whether this is doing the representation of the upper part or the middle part or the lower part. If the person is having black spot here, what we can understand. So this is the uppermost part of the body. Then I asked, okay, do you suffer some brain problem? Okay, do you having some like muddy brain or the dizziness or some some problem in your head reason? The patient told yes. Now I have applied this technique to many of my patients. Now whenever this part is having pigmentation, the meaning of pigmentation, the meaning of dark color or the black color, the energy is not flowing. If this part is red, suppose this part is red, this part is red, then what is the diagnosis? The meaning of this, in the upper part, the person is having more heat. One patient came to me and told me, doctor, I am suffering with the ringing sound in my ear. A ringing sound in my ear. Then I told, okay, show me your tongue. And this part was absolutely red, total red, this part. So what we have to treat? Because the patient is complaining the ringing sound in the ear. So we will just think about the ear. Oh, we can do this, we can do that. But this part was fiery red. And each and every other part of the tongue was quite normal. Then person told me, yes, doctor, I'm not able to sleep. I feel lots of heat in my brain. And I have come to you for my ringing sound in the ear. I am having too much tinnitus or the ringing sound in my ear. I have tried many therapy, but it's not working. So what we have done, we just worked on this upper part, and because the fire is high. Now we will also discuss what is the meaning of fire. So let's go ahead and see the next. One person came to me and told the doctor, I am suffering with the chest pain. Can you treat my chest pain? Okay, so the person was having chest pain. Then we have seen the tongue. In the tongue, when I saw this part, this middle part, this part was having central crack. So whatever the problem is this, but this crack is in the stomach area. So then I asked, okay, do you have some stomach problem? Then person told, no, I don't have any stomach problem. Okay, do you suffer with some acidity? Yes, sometimes I suffer with the acidity. Okay, then just I told the person, take the black dry grapes, soak in the water 20 grams and eat in the morning because I targeted the stomach heat. So just 20 gram black grapes, dry grapes, soak in the water, take in the morning. And if, as per the acupuncture, we want to do the treatment, we have to do the treatment of stomach heat. And what is the meaning of stomach heat? What is the meaning of stomach yin? Is the deficient? We will discuss. So just we have to do the treatment of the stomach if we see some changes here. So tongue diagnosis is helping, because when the patient is complaining you, can you treat, I have some very unique disease, then we are asking, okay, tell me what is the name of disease? Guillain-Barré syndrome. We are getting confused. What is this? But as soon as we see the tongue, we find out whether the problem is here or the here or the here, or whether what is the nature of the problem. So this diagnosis is helping us. So this is the Ayurveda tongue diagnosis, and we will discuss in the very detail. So now this is the TCM tongue diagnosis. The TCM tongue diagnosis, this is the one image of the TCM tongue diagnosis. Even we are having reverse imagination. So as per this image, the tip of the tongue is doing the representation of heart. So just I'm coming back to my patient. My patient told me, can you treat my tinnitus or the ringing sound in my ear? Then I treated the heat from the upper part. Okay, so one patient came to me with a complaint of insomnia. Can you treat my insomnia? I'm having very disturbed sleep. I'm getting up every hour. So can you do something? Then I saw the tongue. Okay, this part was red, fiery red. Then what is the diagnosis? The person is not able to sleep because of heat in the heart. Now, you balance the heat whether with the acupuncture or with your nutrition plannings or with the yoga, Ayurveda. If you balance the heat where in the heart, person will start sleeping. So if you are an acupuncturist, what you can do? Definitely, the sun point of the heart is heart 7. The fire point of the heart is heart 8. And the boot point of the heart is heart 9. Said it all. These are the very good point if you want to reduce the heat from the heart. Now suppose if you want to go very naturally, then no problem. You have to calm down the heat from the heart. Then what to do? We are having many medicines in the Ayurveda or in the naturopathy which can calm down the heat in the heart. And the best remedy, tell the person, take frequent relaxation steps. Like suppose if the person is doing lots of work, then take the break for 10 minutes every 2 hours. So let the heart get relaxed. And there are many ways we can go with the herbs, or we can reduce the heat in the heart by the acupressure or by the acupuncture. As soon as we balance the heart, person will feel very good. So as per the tongue diagnosis, whatever the problem is there, but we are treating the person. One patient came to me and told, can you treat my tremors? I am suffering with the tremors. Then I saw the person is having the black spots on this part, black spots. Then this spot belonged to the liver and gallbladder. Then just we treated the gallbladder, and in this way, the TCM diagnosis helping us to diagnose the problem. Now we can treat with the TCM or with other methodology. So in this way, if we see the TCM diagnosis, the uppermost part of the tongue is doing the representation of heart. So this is the heart. This is the heart. And near about 1 inch area of the tongue, 1 inch area, or instead of 1 inch area, we can tell 1 chun area. This whole area is including the heart. This is doing the representation of lungs. So if you see this small area, this is the heart. But if you take this whole area, including the heart, it becomes lungs. Okay, so kids are coming to us suffering with cough and cold. What to do? Okay, so your tongue. So when we are looking the tongue, this whole part is red, because most of the time when kids or the child till the age of 7 to 10 years, like 3 years, 5 years, 7, 10 years, most of the time they suffer with the cough and cold. It is because of the heat condition. It is called heat condition. So in this condition, because the person is having cough and cold, we are reducing the lung heat. As soon as we are reducing the heat from the lungs, the person are getting relief in the cough and cold. So sometimes it has happened, the person is suffering with the cough and cold, we are giving antibiotics, but even after giving the antibiotics, not getting the relief in the cough. Why? Because heat is already high and you keep on giving the antibiotics. So in this condition, we should diagnose first that whether this is a heat condition or is a cold condition. Because it's a heat condition, then this tongue part will be red. If there's a cold condition, then it will be pale, means no blood. Okay, so this is the lung. Now, if you see the central part of the tongue, it is doing the representation of the central body. The meaning of central body, all the digestive part means spleen and stomach, right? So spleen and stomach, suppose someone is having many cracks here, so it is disturbed digestion. Okay, now if you are going on the side is doing the representation of the liver and gallbladder. So we are going to discuss liver and gallbladder in the detail. And the base of the tongue doing the representation of the lowermost part of the body. The lowermost is kidney, urinary bladder, and the intestine. So this is just overview. We cannot just declare everything just by looking the organ. If you remember, we have to see the body of the tongue, the coating of the tongue, many things of the tongue. But this is the one map which is also doing very good help. Let's see now. So when we are doing the tongue diagnosis, we have to remember a few things. Number one, your tongue is unique, like our fingerprints are unique. The tongue of every person is absolutely unique. If you are doing the tongue diagnosis, so you ask the person, and better to do the tongue diagnosis like just by doing simple brushing, but not the deeper tongue cleaning. Otherwise, you will not able to find out the real tongue coat. Because if someone is peeling the tongue coat, then you will not able to find out the real tongue coat. The point number 3. And it's really normal when we are doing the tongue diagnosis, we are telling the person, okay, kindly be comfortable. I may ask you to show your tongue 3 to 4 times, plus minus, because I am doing the very deeper diagnosis of the tongue. So kindly when I ask, please show me your tongue. Okay, so kindly ask this permission from the patient, because we are asking the patient to show the tongue for 3 to 4 times. Sometimes we are looking the color of the tongue, sometimes we are focusing on the shape of the tongue, sometimes we are focusing on the other changes of the body of the tongue. And the person is eating certain food items, like many person chewing the tobacco, it might change the color of tongue. So when the person coming to you during the first consultation and taking the appointment, and tell them, please don't eat anything like the pan, like the tobacco, anything. Otherwise, we will not able to do the proper diagnosis. Okay, you can enjoy after the diagnosis done. So you can call the patient in the morning if the person is addicted for some tobacco. Otherwise, it will change the color of the tongue. Even I feel this difficulty many times, because I want to diagnose the tongue, but person is having something in the mouth, so it become very difficult. So now, some feature of the tongue definitely will not change, but some feature is going to change. So when you are doing the tongue diagnosis, kindly see these points and even guide the patient on the phone call before arriving to a clinic. Now, look at here. So now we are going to see the many condition of the tongue, like sometimes we are getting attack of the disease from the exterior. Sometimes there is a interior attack. The meaning of exterior, suppose you are getting flu or the viral attack, that is exterior. Suppose you are angry, and because of the angry, you are developing some internal problem, because you are fearful, you are angry, or something happened inside, then this is called interior condition. So now we will go through with all the condition: exterior condition, interior condition, and the cold condition of the tongue, heat condition of the tongue, axis condition of the tongue, coating of the tongue. So we will go through flaccid and thin tongue and no coating on the tongue. Okay. So let's see all the things one by one.